back on the Zero Hour. This is your host, Richard RJ Eskow. In recent weeks, we've been talking about this a lot. In recent weeks, we've seen tens of thousands of people die in nursing homes across the United States. I believe that as I speak these words, the total is somewhere in the neighborhood of 56,000 deaths in nursing homes. Here to join me to discuss that is Abigail Zapote. She is the executive director. I don't know why I'm having trouble talking this afternoon. She is the executive director of Latinos for a Secure Retirement. She's been on the program before, and her group has been very active in addressing this issue of the nursing home crisis. So first of all, Abigail Zapote, thanks for coming back on the program.
Of course. Thank you so much for having me here again.
Absolutely. And, I don't know, the last time you and I talked about a secure retirement, your organization has obviously been focusing on protecting Medicare, Social Security, pension plans, all those types of things. I'm not sure either of us expected that we would be forced to fight to protect the lives of mostly seniors from death due to pandemic and negligence. But are you as shocked by this as I am?
100%. I think, growing up, my hometown of Richardson, Texas, is actually in an aging community, and there are a lot of retirement homes there. And a lot of my friends worked at the retirement homes there. We made friends with some of the seniors that lived there. And so on my end, through my experience, I was always just so happy to see that these communities were working together. The folks that lived in the communities worked in the retirement homes. It was definitely just really great just to see the community there. But now, moving forward 10 years from when I graduated high school and seeing this pandemic, seeing how it's ravaging communities across the country, it's specifically Latinos and Black Americans, but seeing how vastly it's hurting folks in nursing homes. I mean, looking at the statistics, and it shows that about 50% of coronavirus deaths nationwide have been coming directly from nursing home and long-term care facilities. It's something that we definitely need to be talking a whole lot more about.
So I guess one of the questions that people have asked, well, first of all, I should say, Abby, that I'm glad you mentioned, being a teenager and having friends who worked in nursing homes. I worked in nursing homes myself when I was young in school, and I remember what it was like, and I try to picture it today in the day of COVID, and it must be so different and so frightening, even when people aren't sick. Yeah. But what are your thoughts on the origins of this disaster? I mean, 56,000, probably more. We're probably not getting the full numbers.
Yeah.
This mass wave of death. What are your thoughts about how we got here?
Yeah, I think, first and foremost, not having a real federal response to the COVID crisis has clearly caused tragic deaths across the country. I mean, it hasn't been until last week that the administration has finally talked about putting on masks, and seeing the president finally putting on a mask. It's like, wow, we're about 6 months late to really address the problem, which I think is why we're seeing so many deaths in nursing home facilities. But I think also the inequities that the workers there, are seeing day to day, not only with not getting paid enough, not only by not having real access to healthcare, but them also having to work 2 jobs to be able to even make rent. And, because they don't have healthcare, they're also, taking, if they get sick at work, they're also taking the virus back to their families. And so, it stems from not having not having a direct response to the crisis. But at the same time, we just see how much it's trickled down to regular folks that are just trying to go to work, but are getting sick.
Yeah, I've thought so much about those workers in recent weeks, so I'm glad I'm glad you brought that up. I mean, most of my fellow workers were African American and
Mhm.
Latino, and most of them, all of us really, were paid very little. So I was living at home, so it didn't affect me the way it affected
Mhm.
most people. And the pressure was already so great to like get to this bed, get to that bed, turn this patient,
Mhm.
bathe that patient, feed them all,
Yeah.
already. And I just keep thinking, if everybody keeps telling us how important frontline workers are, but
Mhm.
I feel, you'd know better than I feel like we're not doing enough for those frontline workers. We're not paying them more. We're not giving them medical care, adequate medical care in a lot of cases. I don't think most of them have adequate PPEs, but am I right about that?
Yeah, you're completely right. We've heard from several workers from SEIU that, are thankfully have unions, but I mean, even those folks are telling us that they're having to use trash bags, they're having to reuse masks, and as we're talking about social distancing, right, and how that's supposed to protect us, you can't social distance while taking care of other folks, right? You have to you turn their beds, you have to make sure that you're cleaning them, bathing them, etc. Like that's what it really means to be a frontline worker in a nursing home. And so, you know, these folks are literally risking their lives every single day by going to work, and all they're trying to do is really take care of their patients, of the seniors that are there that have become family to them, right? And they know that they have to go to work. It's if they had a decision, a choice to stay home, even if they knew that they weren't going to have enough money, their hearts are telling them to go into work, because otherwise those seniors won't have anybody else to take care of them. Because of course, nobody else is going to want to take these jobs, knowing the risks, knowing that they're not getting paid enough, knowing that they don't have access to healthcare, knowing that if they do take this job, they have to take a second job to even make ends meet. It's really ridiculous what we're putting these workers through.
I couldn't agree more. And again, we're talking with Abigail Zapote of Latinos for a Secure Retirement. What do you think, Abby, about this argument? We had the Republicans saying it's not President Trump's fault or the Senate's fault. It's all these Democratic governors. First, they said they were overreacting, then not doing enough, and all of that. And I'm not saying the governors did everything perfectly, but first that was the argument. And now that states with Republican governors are having soaring rates of infection, like Florida, for example, now we're hearing them say, well, it's the Democratic mayor's fault. But what do you think of this whole line of argument that it's really the governors that are to blame or somebody else?
I think it's just a ridiculous notion, right? I think that there was definitely time for governors in the South and the West and the Midwest to prepare after seeing how New York was ravaged by the virus, seeing how Washington State was ravaged by this virus. This was happening in early March into April, and finally, those states are finally seeing a drop in cases. And so for folks for the governors in Florida, for the governors in Georgia, Texas, who are seeing that spike, they had ample time to figure out that maybe they shouldn't have reopened as fast as they did. Maybe they should have continued to, you know, ensure that their whole state was taken care of. And even if I think just recently, like Texas, the state where I'm from, and my governor there, he said that like masks were mandatory now in public places, but that there were some exceptions. And so, how are you going to say that there should be exceptions at places of worship, during any kind of professional leagues or whatever? Like if there are places where people are gathering, there should definitely be one, they shouldn't be doing that, but two, there should definitely be masks that are mandatory. And so what I'm just trying to get at is that there was ample time to learn from what happened in New York. And I do think that it does go top down. And especially in places like Houston, where one of the county commissioners, I believe, Lena Hernandez, and if I'm getting it wrong, I'm so sorry to Lena, but she, specifically asked and gave a mandate for the city of Houston to increase social distancing, to have masks be mandatory. And then Governor Abbott decided to overrule that it's going to be the governor's mandate to not have any masks. And this was early in June. Obviously that has changed. But what I'm saying is that, you can't roll back knowing that back in New York, back in April, we were seeing how the cases were rising. And there should have just been a whole lot more learning and seeing what Governor Cuomo did, or what Governor Inslee did. There was just ample time to really create good rules that could have been followed, and best practices that could have been followed in the different states.
That's a great point. And before I let you go, Abby, I wanted to ask you, and of course, if there are any other points you want to make before you go, let me know. But I wanted to ask you what people can do either to get more informed on this issue or maybe to do something about it.
Yeah, so we're so excited to partner with Social Security Works to really create action for folks that are listening. They can visit us at nursinghomecrisis.org, where you can put in your information, and we'll be sending over actions that you can take. We definitely know that Congress needs to act as well to ensure that there is ample money that is going to these different nursing home facilities, because they still need PPE. They definitely still need to be able to give pandemic hazard pay to the workers that are there. And so, we still need to be urging the Senate to pass the HEROES Act. We know that a lot of folks at home who are also experiencing, being unemployed, who are, after July won't be getting the additional $600 unemployment benefit in addition to what they were receiving from their states. There's a lot that can be done as a whole. And I think that that's really showing through the HEROES Act and a couple of different bills that are being proposed both in the House and the Senate. So, the August recess is coming pretty soon. And so folks really need to visit at nursinghomecrisis.org so that they can also, so Congress can also hear their voices too.
Well, Abigail Zapote, once again, Abigail is the director of Latinos for a Secure Retirement. You can find them at lulac.org, I believe, right? LULAC.
Actually, we're now at latinoretirement.org.
Oh, okay. Thank you for that correction. latinoretirement.org. Thank you for your great work in this area, Abby. And as always, thanks for coming on the program.
Thank you so much for having me.
And we'll be right back after this. I am Richard RJ Eskow, and you're listening to The Zero Hour.